The purpose of this video is to show you how to provide a sputum specimen that was requested by your healthcare provider. Sputum is the mucus you cough up from your lungs. We need this sample to help find a cause for symptoms you're having, such as a fever, cough, or other breathing problems. Even if you aren't feeling sick at all, your provider may still want to make sure that you don't have tuberculosis or another infection that can be spread to other people. The sputum sample you're providing will help figure out the cause of your symptoms or infection, help you get the correct treatment, and help prevent any infection from spreading to others. First, let's get clear about just what sputum is. Sputum is mucus coughed up from deep in your lungs. Normally, it's thick and clear, but if you have an infection, it can be different colors such as white, green, or yellow, and it may have red or brown blood in it. Sputum is sometimes confused with saliva, but saliva is different. Saliva is in your mouth, not in your lungs, and it's a thin, clear, watery liquid. In order to diagnose a lung infection, the laboratory needs to have a sample from where the infection may be. So it's important to have sputum from deep in your lungs and not saliva from your mouth. So please do not spit saliva into the specimen cup. Since most people don't cough much while sleeping, mucus tends to collect in the lungs as you sleep. This means there's more sputum available to cough up when you wake up. So the absolute best time to get a sputum sample is when you wake up. So let's see how it's done. Here are a few easy steps to make sure you get a good sample. First, get your supplies ready before you go to bed. Put the specimen cup and biohazard bag you were given, along with a pen, near your bed before you go to sleep, so everything is easy for you to find when you wake up. When you do get up, use the bathroom if you need to, and make sure you wash your hands afterwards. But do not brush your teeth, use mouthwash or toothpaste, or eat or drink anything. These are things that could contaminate the sample, making it useless. Now open the specimen cup. Set the lid aside so the bottom of the lid is facing up, which protects it from getting dirty. Be careful not to touch the inside of the cup or lid. This cup is sterilized, which means it's been specially cleaned to get rid of any dirt or germs that might contaminate the sputum sample. The next step involves getting ready to cough. Sitting and leaning forward is the best position for a good strong cough. Getting a good deep cough when you don't have the urge to cough involves a technique called huff coughing. To do a huff cough, you need to deliberately, quickly, and forcefully breathe out, making a huffing sound. Here's how the whole process looks and sounds. Now, let's watch each of the 5 steps of the process. The first step is to clear your lungs. You do this by taking a small breath in and then a gentle breath out. Do this 3 times in a row. The second step is to take a deep breath in, then let a gentle huff cough out. Third, take a fast, small breath in, then a gentle huff cough out. Fourth, repeat this fast, small breath in with a gentle huff cough out. Finally, the 5th step is to take a deep breath in, then a single strong huff cough out. This final cough is when you should produce a good sputum sample from deep in your lungs. Once you've coughed up the sputum, carefully spit the sputum into the specimen cup. Your healthcare provider will show you how full the specimen cup should be for a good sample. Please remember, you need to produce sputum, not just saliva. Now, let's watch the full huff cough sequence one more time. Once you have a good sample, put the lid back on the specimen cup and write your name and the time and date on the label. Then place the specimen cup in the plastic biohazard bag and store it in the refrigerator until it's taken to the lab. Your healthcare provider will often need 3 sputum samples collected on 3 different days. Please use this same technique each time. If you've tried this technique a couple of times and still can't produce a good, deep cough with sputum, let your healthcare provider know. Collecting a good sputum sample will help make sure you get an accurate diagnosis and proper treatment as soon as possible. Thanks for watching and good luck with the procedure.